As we look at healthcare across this nation and the desire to have more equitable healthcare, it's important that we have people sitting at the leadership table, but also the board governors table, to ensure that decisions and issues are being addressed appropriately to provide care to the masses that are now coming to our healthcare institutions.
If you look in boardrooms right now, they really don't represent the communities a lot of times that are being served. And so the Leverage Network initiative to really go out and consciously seek to look and find people that are qualified, give them the tools that they need, and then most importantly, make the connections so that you're bringing people that are capable to the actual boards.
Hospitals and healthcare is a social service. Obviously, we serve people, and we should clearly reflect the people in the community that we serve. So relative to boards making up the community is critical, particularly as we move forward in terms of community health as well as population health. We're going to find that boards are going to be ill-prepared to really deal with the needs of the community if they don't reflect the community.
It's been demonstrated over time that the better organizations that do the best job of serving the communities have both executive leaders and board members that look and represent the communities that they serve. So unfortunately right now that's not the case. We're underrepresented as African Americans on boards across the country.
The Healthcare Board Initiative addresses our strategic objective to increase the number of board seats held by African Americans. We have adopted a proven model that prepares, positions, and promotes a cohort of board-ready executives for governance roles across the industry.
But it also gives me an opportunity to influence and talk about this for future leaders to come after me and fulfill this role to be a part of such a great organization and also learn about what it really means to be a board member. Because that's where true decisions are made, that's where governance happens.
The real benefit of it is not so much just to get numbers on a board. The real benefit is that there's tremendous inequity of care. And ultimately what we're really after is to be able to improve the care for the patients that we take care of.
Despite long-term efforts to improve ethnic and cultural diversity in healthcare governance roles, minorities remain severely underrepresented, particularly African Americans. The Leverage Network is a nonprofit organization founded to increase the representation of African Americans in senior leadership and governance roles in healthcare. This body of work is a core part of our mission and has been given intentional and deliberate focus to change the dynamic.
I think the work of the network is so crucial and so needed. And it's important to me and important to healthcare because one of the deficits that we have is a lot of people of color who sit on the board of directors, both for hospital boards and for system boards.
As we look at the need in corporate America and across the world for people to get various perspectives, diverse opinions, diverse perspectives, it's just a time that's come. And so there's a lot of work that will need to be done around getting the visibility, getting the attention of decision makers, and getting the preparation for those who are going to be participating and who will make themselves ready for board seats and being a part of the governance of corporations and healthcare systems across this country.
Has your organization found the right alignment of representation on your board that truly reflects the communities you serve? Is your concern that you can't find the right talent, expertise, or experienced board candidate? Then I urge you to partner with the Leverage Network, and together we can change the dynamic.